Welcome back, everybody. A new study led by Northwestern University shows a strong correlation between the levels of vitamin D in someone and if they go on to have serious complications or even suffer from death from COVID-19. So what does that mean for us all? And is there anything we can do about our vitamin D levels right now? We check in with Dr. Romy Block, who is an endocrinologist and an expert about vitamin D, even wrote a book about it. So good morning to you. I'm glad you're here to talk to us about this. What does this study mean to us, do you think? And is there something that we can do to lower the risks?
That's a great question. Thank you for having me. Vitamin D deficiency is actually very common in the United States since we have done a great job at skin cancer prevention. So we wear a lot of sunscreen, and there's even SPF in our makeup and in hand lotions. So we find that many of us, we're all different, but many of us are vitamin D deficient. And what this study showed is that when they looked at the data from 3 Southeast Asian centers, they found that the patients that had the lowest vitamin D, severe vitamin D deficiency, actually had a much higher level of increased mortality, so increased rates of death. So everybody's different, so it's best to talk to your physician, but we do recommend that everyone take vitamin D. But we want to make sure that people don't go the other direction and take too much vitamin D, because that can be harmful as well and can cause problems with kidney stones and high calcium levels, which can make you very sick. So we definitely want to keep in the middle of the supplementation range so that we don't cause problems in the other direction.
Oh, that is good to know, and I'm glad you brought that up. And if anybody goes to their doctor, they can simply get a blood test to find out their level and then maybe get advice to find out what level. But if someone's at home right now, what do you suggest for them? Do you just read what's on the bottle and just take the recommended amount, which is usually like 1,000 IUs a day? What do you suggest that people do if they decide that they want to supplement with vitamin D?
Yep, I think everybody is a little different. So that's one of the reasons why we created a personalized multivitamin system where you take a survey at VouVitamin.com, and it analyzes what you need, what you eat, what your diet. One of the problems with vitamin D is that you cannot get enough in your diet. So vitamin D in general is made by the sun and is not found in forms of food. It's you can get it in wild caught salmon or in certain mushrooms, but in general it's very difficult to get in your diet. So we do recommend most people need about 1,000 to 2,000 units a day, especially in wintertime or if you're very good at sunscreen.
Okay. And then I know even my own doctor suggests that I take my kids out for about 30 minutes in the sunlight a day and then put on sunscreen. And certainly as you mentioned, I mean, this is Skin Cancer Awareness Month, so I don't ever want to tell people not to wear their sunscreen. But how much sun do you feel like is safe that you could actually absorb it into your skin without putting yourself at risk for skin cancer?
That's a great question, and I don't think we completely have the answer for all of that. I think getting out in sunlight is so terrific, just in terms also of improving your mood. But in terms of vitamin D, what we find in the Chicago area where I'm from is that we have a lot of SPF in products that you don't realize. So it's in your lotions, it's in your makeup. So sometimes even when you think you're getting sun exposure, you're not. So you need to be a little bit careful about that. So that's another reason why we do recommend supplementation.
And then what about skin color? Because do some people absorb more sunlight than others? And then do they really need to be, if that's the case, do they seriously need to be thinking then about supplementing with vitamin D?
That's a great question, and that may be one of the issues that's behind one of the disparities in African American community, that they tend to absorb vitamin D at a lower rate and have more vitamin D deficiency, and we found that not only is the low vitamin D associated with a higher mortality rate in these studies, and it may be associated with the cytokine storm release that causes inflammation and then issues with the viral pneumonia. But it may also, in a study 2 years ago, showed that low vitamin D was associated with an 17 think it's 12% increase in respiratory infections in general. So it may actually play a role in getting coronavirus and then the more severe reaction to it.
All right. Well, it seems like something so simple that we could really think about, talk to our doctor, and perhaps just start supplementing just to make sure we're the safest we can be. Dr. Block, an honor to talk to you. Thank you for your time today.
Thank you so much for having me.